Hello students, welcome to Chapter 5, Medical Terminology. This is going to be a chapter that is super important to you throughout your program, throughout your career in emergency medicine, because if you don't know the terminology, you can't tell people what you did to your patients. And you'll have a hard time identifying certain ailments and conditions and making critical thinking decisions based on the conditions that you find. So medical terminology is that language that we all use in emergency medicine to speak with one another and relatively what's wrong with our patients and how we describe their injuries and their illnesses. All right, so as a quick introduction, EMTs have to have a strong working knowledge. This will also aid you in taking your test in the future, especially, not only our course exams and our course quizzes, but the National Registry exam. You have to know what pericarditis means. You have to know what peritonitis or retroperitoneal space means. If you don't know these things, you're going to miss the questions. So medical terminology is one of those huge things that you got to have within your vocabulary. You need to be able to understand those key terms, okay, for effective communications, your symbols, and also your abbreviations. Also, you need to understand how to determine the meaning of an unknown word by understanding how they're formed. The prefixes, the suffixes, those kind of things. It's what clues you in on what part of the body or what is affecting the body based on Latin terminology to be able to identify and to place that signs and symptoms to be able to report that. And understanding that medical terminology will aid you in communicating effectively with other folks that you're going to be working with, to include doctors, nurses, paramedics, and your other fellow EMTs and other first responders. Medical terms, they're made of very distinctive parts to perform specific functions. Changing or deleting either one word or another word or moving around can change the whole meaning of the word or the function of the word itself. So you've got to know what you're doing when you're using this kind of terminology. Compounds specifically. These are the components. There are four very specific components. The first is the word root. This is the foundation of the word, the actual foundation. Then you have the prefix word part that occurs before the word root. So your root is the foundation of whatever the word is, and the prefix leads you into that root to be able to tell you something about it. The suffix is the word part that occurs after the word root, and that tells you whether it's an infection, whether it's swelling, whether it's enlargement, that kind of thing. So say hypo. Hypo means less or slower. Hypovolemia. Volemia is that root word that means blood. Okay, volemia. So low blood or without blood. Okay, hypovolemia. So that's how we use to determine, based on combining vowels, and they join the root words to other words, and to be able to understand what the ailment is and to describe it so that we can all understand what it means in the medical profession. The meaning of each part and the way the parts come together determine the word's meaning itself. So changing or deleting any portion of it won't work. Okay, you can't do that. If you do that, it'll confuse what the actual condition is, and then your healthcare providers won't understand what you're trying to get across. This is very important when we're writing our reports. And I mean, language itself, as we're speaking to one another, it's important to be able to do this so we can effectively communicate. But once you start transposing that information onto your electronic PCRs, your patient care report, that becomes a legal record. So it has to be correct. So let's talk about word roots. The main part or the stem of a word is what we call that root. Remember, we talked about that, or root word. What it does, it conveys the essential meaning of the word itself. Frequently, it indicates a body part, an organ or an organ system. Renal means your nephrotic system or your kidneys, okay? Cardio is your heart. Respiratory is your breathing, okay? So ventilation is the mechanical ventilating of somebody. So there's so many things that that root word can be, but it usually has an indication of either a body part, an organ, or an organ system. Okay, so prefixes. Prefix is the part of the term that appears in the beginning of a word, such as hypo, hyper, those kind of things. That prefix usually describes a location, a number, an amount, a color, or an intensity. Not all medical terms have prefixes, okay? A prefix gives the word root its specific meaning. Its specific meaning. Suffixes. Suffixes are placed at the end of the word. So prefix is just what it says, pre. It's pre the word. It's pre the root word. Suffix is after the root word. That suffix usually indicates a process or a procedure. Ectomy is the removal. That is a suffix. Appendectomy. Okay, that's removal of the appendix. It also can describe a condition, a disease, an amount of something, or a part of the speech. Okay, so combining the vowels, very, very important. A combining vowel is the part of a term that connects a word to a root word, to a suffix or another word root. In most cases, all right, it is an O. Okay, however, it can also be an I or an E. It is used when joining a suffix that begins with a consonant or when joining another word root. The combining vowel helps ease the pronunciation of the term. So we're going to give some examples of that. Hang on, everybody. We're almost there. We're getting there. Back to English 101 with the application to emergency medicine. That's where we're at. So hang on. All right. So word building rules. There's some basic rules. Okay. Basic rules. The basic rules when building or taking apart a medical term. The prefix is always at the beginning of a term. However, not all terms will have a prefix. They don't always have a prefix word in front of it. The suffix is always at the end of the term. A combining vowel may be used between word parts to aid in pronunciation. Okay, so these are some basic word building terms. Plural endings. So singular versus plural. Singular means a singular event, just one. Plural, as you remember from English, means more than one. Okay, but certain rules do apply. To change a term from a singular to a plural form, certain rules do apply. Sometimes you can simply add an S, such as lung. Lung is one. If you add the S, lungs, that means both of them. Okay, it means both lungs, left and right. Okay, but some rules are more complicated. Rules you may encounter when converting from singular to plural terms are singular words that end in an A to change it to AE, such as A changed to AE. Vertebra means one vertebrae or vertebra of the spinal column. When you say vertebrae, it means one or more of those vertebral bodies. Okay, so you have a bone, it's called a vertebra. And when you say vertebrae, it's more than just one of those bones. IS changed to ES. Diagnosis, that's a singular. I have one singular diagnosis, chest pain. Rule out myocardial infarction or heart attack. If I have multiple diagnoses, I will say diagnosis and put an ES. I have chest pain with rule out MI along with shortness of breath, rule out pulmonary edema. as relative to congestive heart failure. So those are two different diagnoses that are relative to one patient complaint. I can't breathe and I have chest pain. Okay. All right. EX or IX changes ISIS. So apex. Apex is the point or the end. I'll give you a perfect example. Your lungs have an apex. Okay, it's the very tip of each, the base of every lung. So if we're talking about both lungs, we want to refer that we hear fluid in the apices of the lungs. Apices of the lungs. So now I have made it plural. Instead of saying apex of a lung, because it would have been fluid in the apex of the right lung, I can say apices of the lungs. That would include both. On or change to ganglion to gangula. Ganglion is the nerve end. Ganglion is nerve endings of multiple nerves. Ovum to ova. Ovum is a singular egg, release of a singular egg. Ova is more than one egg. Okay. Us changed to I. Bronchus. In our lungs, we have bronchioles. If you want to say singular, you say bronchus. Right main stem bronchus. If we want to include both sides, I hear rhonchi in bilateral, or I hear rhonchi in the bronchi, then that's both. Okay. Instead of rhonchi in the right bronchus, that's one. So that's how we're changing. We're playing that game with singular and plural. You have to be careful how you say it, but these are the commons. You have A to AE, IS to ES, EX to IX, ON or OUM to A, or US to I. Okay, so this is the way that we use this terminology to describe plural and singular. Prefixes. Remember what prefix is? Prefix is that indication or word. It's a special word part that comes before the root. Okay. Prefixes can be used to indicate numbers, colors, positions, and directions. So numbers. Okay. Some prefixes indicate a term that involves a number or two or more parts or sides, such as una. Una, okay, una is a term unilateral. That's one side. If I want to say bilateral, that's both sides. Okay? Very simple. Multi-trauma means multi, there's more than one. Okay, so all of these terms we can use as a prefix to enter the root word to say more than one or singular of one. So it's a number, a singular number that's used as a prefix. Colors. Several words describe colors. Okay, cyan or O, leuco, erythro, cero, CO, Milano. These are all different types of descriptions for colors. Okay, so these are prefixes that we're going to use as a word part to describe something. Leukocytes is a white blood cell. Erythrocytes is a white blood cell. Okay, cyan is the color of blue. Okay, so it's cyanosis. Patient has a cyanotic appearance, blue appearance. So these are examples that we can use to describe colors. Positions and directions, very, very, very important. Lots of positions and direction. Ab, ad, d, circum, peri, trans, epi, and supra. We're going to give you some examples here of that. Abduction, adduction, circumferential, perimeter, periorbital, epidural, supra. These are all common prefixes that we can use as a word part to describe something. So when we're talking specifically with these prefixes, we can also use directional terms. Okay, this chart is in your book. It tells you about distal and proximal. Don't get this mixed up, because I tell you something, sometimes you really got to think about what the question is asking you. The elbow is what from the thumb? Okay, the elbow is what from the thumb? It is proximal, because if we look, okay, gonna make a little example here. If we look, the thumb is here, and they're asking about the elbow. So the elbow is what from the thumb? If you look at this directional arrow, it shows you that it's proximal. Proximal is towards the heart, distal is away from the heart. Okay, so that's a description. Here, inferior, all right, versus superior, okay. The head is superior of the foot. It's above, okay. The head is superior of the belly button, or the umbilicus, okay. These are terms. Medial. Medial is towards the inside of the body. Lateral is towards the outside of the body. So this area here is the medial aspect of the left thigh. This area here is the lateral aspect of the left thigh. Always remember anatomical position. This is the left side. This is the right side. You always have to think about the patient's anatomical position. This person's standing in an anatomical position. It is the patient's right, not yours. Okay, when you're making these descriptions, it's the patient's right, not yours. Anterior, here, that's the chest or the front. Posterior is the back, it's the rear. Okay, you can have anterior and posterior problems. I can hear rales and bronchi in the lungs, both anterior and posterior. And bilaterally, that means both sides. Okay, so it's not hard, especially once you get used to talking, get talking about it. So you got to practice this and practice your positioning. So I know that a lot of people get hooked up on proximal and distal. There's so many test questions that test you on that proximal and distal. Anterior, posterior is pretty easy, okay? Left and right is pretty easy. Superior and inferior is pretty easy. But sometimes you get stumped up on the distal and proximal. Common directional term to continue: ventral and dorsal, right and left, superior and inferior, proximal and distal, lateral and medial, superficial and deep. So these are the same kind of thing that we were talking about earlier. Let's go back to ventral and dorsal. Okay, so it's the same thing as anterior and posterior. Ventral is like the ventral fin, okay, the ventral fin. Dorsal is the dorsal fin on like a shark. Okay, so it's the back. Ventral is the ventral surface or ventricular surface, like your heart, so it's the front. So it represents, ventral is the same thing as posterior, and ventral is the same thing as anterior. Now, most people use anterior and posterior, not ventral and dorsal. You won't see that very much unless you talk about the lower extremities, like dorsal pedalis, your dorsal pedis. That is a pulse that is on the back side of the kneecap. So that's another way of describing that. All right, terms right and left. Again, we talked about this. It's the patient's right and left, not yours. Okay, don't forget that. Superior and inferior, we talked about that. Superior portion is nearer the head from the specific reference point. Inferior portion is nearer to the feet. Okay, it's also used to describe the relationship of one structure to another. Lateral and medial, we talked about this. Again, lateral are all your outer surfaces, away, okay? And medial are all the surfaces within. Perfect example. Patient has a laceration to the right medial thigh. So it's the inside of the right thigh. Okay, that's how you would describe that. You don't say, hey, it's on the inside of the thigh. It doesn't work. Okay, you say it's on the medial aspect of the right thigh. That's perfect. That's all you need to say. The physician or the nurse will know exactly what you're talking about. Proximal and distal. We talked about this. Okay, proximal, all right, is towards the heart, towards the trunk of the body. Distal is away from it. Okay, very simple, easy peasy stuff. Superficial and deep. Superficial on top. So it's a superficial part of the skin, superficial part of, the surface, whatever you're trying to describe, versus deep. That's way down inside. It's beyond that first layer of skin. Ventral and dorsal, we talked about that. The ventral is that belly side, okay, or the anterior portion of the surface, okay, and dorsal is the spinal side, kind of like the shark with the dorsal fin. So remember that. It's another way to put it, but really not very many people that I know of use dorsal and ventral. It's always anterior and posterior, and that's completely up to you, but both are correct. And if you see it on a test, you need to be prepared to answer it correctly. So don't totally put ventral and dorsal away in the file 13 cabinet of your brain. Make sure that you remember that. Palmar and plantar. It's the anterior, the section of the hand, palm surface. Okay, we all know the palm of your hand. Okay, and the plantar is the bottom of your foot. Pretty simple. When we talk about reference to a problem, a person has pain in the bottom of their feet, we can usually relate that to plantar fasciitis. Plantar, bottom of the foot. Fascia means the layer of tissue that covers the muscle. Itis meaning inflamed, okay, or irritated. So plantar fasciitis, very simply, means you have pain in the bottom of your foot. It's not an injury, it's a pain from an affliction or a condition of inflammation. Apex, we talked about that too. Apex, specifically like the pleura, okay, apices, it's the tip of a structure. All right, so flexion, very simple, making the muscle, okay, extension, putting it out, okay, flexion, extension. That's very good in explaining terms of injuries to the upper extremities. Adduction and abduction. Abduction is going away, okay? Add is adding it to the body, so it comes towards the body. So it's adduction is towards the body, okay? Abduction is away from the body. Get that in the brain. These are test questions. Don't let these things jump out at you. Just memorize them, get them in your head, because you're going to be using them in describing injuries. I can't say, oh, well, it was away from the body. Yeah, it's no problem. Or, yeah, his arm was bent like this. No, that does not work in medicine. You've got to give it a good professional description so people respect and know that you're educated in emergency medicine and you're in on your physiology and being able to describe it. Goes a long ways. Other directional terms, okay? A body part that appears on both sides of the midline is bilateral. Okay, structures inside the body may also appear on both sides of the midline. Something that only appears on one side of the body is what we call unilateral. Bilateral, if we're describing that we have bullet holes bilateral in the chest, the anterior portion of the chest, that means it's on both sides, okay? Unilateral would be on one side. We hear wheezing bilaterally. That means to the person reading that, both lungs are wheezing. That's not good, okay? Especially if your patient is cyanotic. What color is cyanotic? Come on. You know what this is. Cyanotic. Blue, correct. You were thinking blue, you are correct. So that patient is hypoxic. Hypo, that means less. Oxid, less of oxygen. Hypoxic, which causes cyanosis. which subsequently can cause bradycardia that's relative to that condition. Wow, I just said a whole bunch of stuff with just a few short words. And that's why we do this. So we can explain a whole bunch of stuff in a very short sentence. Okay, areas of the abdomen are divided up into 4 quadrants. You can see them on this diagram. And you see RUQ, LUQ, right upper quadrant, left upper quadrant. And then RLQ and LLQ, right lower quadrant, left lower quadrant. Bingo, right there. You can see the organs that are in there, all right? Some of the important parts about that I want you to draw your attention to is this word right here, costal arch. That costal arch is this directional right here, okay? And that's, you know, right in that area, okay, is a very defining moment of what when we use it to describe, you know, the patient's conditions and the organs that are in there. In that right upper quadrant, you know, we have the liver, okay, right there, right upper quadrant. All right, the stomach is laying back behind here, okay. You also have in here, there's your gallbladder, right there. All right, and then you have what's called the transverse colon, which is the top part of the large. Okay, then you have the ascending colon, which is this part, and the descending colon, which is over here hidden behind the structure right here. That's your descending colon. It goes down to where it empties out into your rectum. Okay, so we can make a lot of analogy and a lot of thought processes based on injury. If I see a bullet hole right here, okay, it could involve the ascending colon. Okay, if I see a bullet hole right here in this area, that's bad. It can involve the liver. It could also involve, because the lungs are, you know, behind, you know, they drop down a little bit behind the liver, especially the upper portions of the liver. And so it can include both. This would be a very serious type of injury, you know, a serious type of wound. The 2 lines that intersect the quadrants is the umbilicus, or the umbilical, as your belly button. Okay, it's right in there. And then those 4 different quadrants. So this is very important to know, you know, these areas, because you can be relative to what's going on with your patient. You can understand, especially in blunt trauma. If you see blunt trauma over here in this area, okay, boop, boop, all right, then obviously it can affect the small intestines and the descending colon. So very important stuff when you're looking at injury patterns on your patient or pain that they're complaining of. Continue on, prone versus supine. Supine, okay, right here, laying on their back. Prone, here, laying on their stomach. Pretty simple, prone versus supine. We can't manage patients very well in that prone position. So we want to get them in a supine position as soon as possible so we can manage their airway, manage our treatment, those kind of things. You can't defibrillate people or do CPR when they're prone. It does not work. You must roll them over. So these are those 2 positions, and you can find your patients in either one of these positions. All right, so Fowler's position. Fowler's position is a semi-reclining with the head elevated position. You have semi-Fowler's, which is at 45 degrees. And then you have high Fowler's, which is straight up, which is 90 degrees. Folks, I want you to make sure that you make note of this because these are test questions, okay? You're going to see them on National Registry and you're going to see them on your exam as well. So please make note of this. Okay, so breaking these terms apart. Remember, we talked about suffixes, prefix, and root words. You guys are experts now. What's the root word? Right, it's the one in the middle. Okay, it is that solid word. It's identifying what that organ is or whatever it is that we're talking about. And then the suffix is at the beginning or the end. Right, it's the end. Suffix, suffix. And prefix, that's the easy one. It says pre, that means first or before. Simple, simple, simple. The prefix is before the root word. All right, so breaking these terms apart. neuropathy, okay? Neuropathy. So, pathy is the suffix, okay? Pathy is the suffix right here. Pathy. It's at the end, right? Okay. O, okay, is what we call the combining form. Okay, combining form. And then nephra, okay, this word here, it is your root word, okay? We're using a combining word on this, all right? So the combining word is just bringing the two together. The nephro is describing the kidney, okay? It is the kidney. Nephritis is an inflammation of the kidney. The I is the combining word of itis. Okay, it's the combining, the itis is that suffix that tells you exactly what's wrong with that. But nephropathy is a combining, which is our O, for disease processes of the kidney. Okay, so once again, neuropathy is disease of the kidney. Very simple. Okay. That's how we put these together. Dysuria, dysuria. IA at the end, okay, IA, which is your suffix, meaning a condition of. IA is a condition of. Dys, D-Y-S, there's your prefix. It's meaning difficult. Dys means difficult or painful or abnormal. U-R, meaning urine. So dysuria, okay, very simple, means it's a condition of difficult or painful urination. Dysuria, painful urination. Instead of saying painful urination, we could say patient has dysuria. Instead of, hey, painful has a painful urination. They have pain when they piss. That's not the right thing to say to be professional. They want to hear you say dysuria. They want you to be able to describe it. They want you to be able to write it in your report. Hyperemesis, okay, hyperemesis. So let's break it apart. Hyper. It is the prefix meaning excessive or too much. Hyper. Emesis, this is the word that means vomiting, okay? It means vomiting. It's Latin for vomiting. So hyperemesis is excessive vomiting. Let's take another one that's hyper. Hyper, meaning excess, ventilation, which means breathing. It's the effect of breathing. It is the mechanical portion of it, of breathing. So hyperventilation means that the patient is breathing too fast. You can either say hyperventilation, conscious, hyperventilation, unconscious. The hyperventilation is being caused by usually the person that's manually ventilating somebody. We'll talk about that in airway. But the point of understanding what hyper means and then putting it with emesis, bam, you got it. They're puking a lot. Okay, that's just not the way you want to describe that. So they have hyperemesis. Okay, so you can say nocturnal hyperemesis if they have a lot of vomiting at night. So interesting, huh? Good stuff. All right, let's continue on. So again, analgesic, analgesic. Okay, AN, okay, AN means algis, okay, or IC, algis, all right. The next one means, and algis means it's pertaining to, okay. The IC means pertaining to whatever algis is, and AN is the prefix meaning without, and algis means pain. Algis is the Latin word for pain. So we use analgesics, such as Tylenol or ibuprofen or whatever it is, to be without pain. So if we want to say that the person is analgesic, it's pertaining to no pain. If you want to say the patient had trauma to the right shoulder, but was analgesic, that means they had trauma without pain. Okay, so another way of describing it, and we use analgesias to create a condition of no pain. Like I said, aspirin, ibuprofen, Tylenol, those kind of things. Shorthand used for communication. So medical abbreviations is that shorthand. We do have a list of accepted abbreviations for this school. It is in your LMS and it's also in your classroom. So be sure that you're using only abbreviations that have been approved by our medical director. What they are is it's shorthand. It's developed because one could communicate faster using this method. You know, S with a line on top of it is without. C with a line on top of it is with. It's just so much easier to, and you draw that C, put that line on it, it's with. Patient with analgesic, patient with pain, whatever. Use only commonly understood abbreviations, period. Don't use anything else, because otherwise you're going to be killing, me as the reviewer of your medical reports. So I'm going to be kicking them back and say, hey, this is not in your list of abbreviations. Make sure that you correct this, because yes, you have to fill out what we call PCRs, patient care reports, in your Platinum software on every single patient. So make sure that you are only using approved abbreviations. All right, so abbreviations, like I said, it's an umbrella term for any word or phrase that has been shortened so it may be spoken or written more concisely. You're going to encounter all kinds of abbreviations, some you may not even understand. Hopefully, they'll match your abbreviation sheet. And like I said, don't use anything else. What's on the abbreviation sheet? And if you ever have any questions, you can bring it to me or one of your instructors. Only use symbols that are widely understood and accepted. The master tables, there is a section that's in your book as well that's very helpful. Everything that's on those master tables in your book are also a part of our program as well. All right, so review. Which of the following components of a medical term conveys its essential meaning? Which one conveys its essential meaning? Come on, you can do this. Come on. All right, if you answered C, the word root, you are correct. Very good, very good. There's your reasoning, your rationale. 2, prefixes can indicate color, conditions, body parts, procedures. What do you think? Prefixes. What's a prefix? Pre. So when it comes before the word root, right? Okay, it's A. It's used to indicate colors, numbers, positions, or directions. If you answered A, great job. There's your rationale for it. The plural form of the word bronchus is, come on, plural. Plural means more than one. Okay, singular is bronchus. So what is it? Which one is it? Come on. If you said D, you are correct. It should end in US. Okay, the plural form will end in I. So bronchus, bronchus, we're talking about more than one. There is your rationale. All right, the statement, the lungs are superior to the bladder, indicates that lungs are closer to the what? Superior. The lungs are superior to the bladder. Come on, you can do this. So superior, what does superior mean? Okay, superior. Okay. So it's C, this term superior is used to indicate a structure that's closer to the head. Okay. Inferior is used, closer to the feet. So C is correct. 5, movement of the arm towards the midline. Towards the midline, going this way. Okay. Arm going towards the midline. What is it? If you said adduction, you are correct. C is correct. Good job. 6, a body part that lies closer to the midline when compared to another is so closer to the midline. Okay, closer towards the midline. Yep, the midline, towards the midline. Is it medial, distal, lateral, or proximal? Midline. Think about it. Laceration on the inner thigh. Does that help you? Okay. A, yes, it's medial. Always remember medial is towards the inside. I use that one a lot, especially when I'm describing burns and lacerations, ingrown hairs, infections, all that kind of stuff towards the middle. And usually it's relative to an extremity or, anything that's onto the chest towards the midline, chest or abdomen. So yeah, there's your rationale. This is used to identify a body part that is on the belly side, or interior surface of the body. Remember, I told you that you get some of these belly side. Remember, it's not the shark side, it's the other side. Hint, hint. Okay, let's see if you get it right. D, ventral. Ventral is the same thing as the anterior surface. It's on the belly side, ventral. Here's your rationale. Okay, you place the patient in a semi-Fowler's position. Semi-Fowler's. So what's the degree? Okay, so we've eliminated A and B because we're talking about degree, right? Now, they're asking you what it is. What is it? If you answered C, yay! Super, yeah. Semi-Fowler's is 45 degrees. High Fowler's is 90. Okay, good job. There's your rationale. Okay, laceration located on the plantar surface on the what? Where's the plantar? Remember we were talking about fasciitis before. Got a pain in my foot. Yeah, a sole of the foot. Good job. Rationale. All right. 10. When usually abbreviations, acronyms, or symbols, an EMT should. What do you think? D. You need to be familiar with it. You need to know what it is. Okay. Know what's accepted. Follow what's accepted. Make sure you're not going outside the guidelines. Stay within your lanes, man. Definitely. There's your rationale. All right. Well, wonderful stuff. Appreciate it. We'll see you next time.